Today I wanted to tell a little story about once upon a time when I was a pediatric nurse in the hospital and what the experience was like for the first patient that I had that passed away. Now, this story is not going to interest everybody, but it will interest a lot of people who have experienced a loss, to feel maybe less alone, to understand that nurses who take care of children and maybe experience time with your child before you do at the time of passing, what we do, what it looks like. Now, I'm not going to say, of course, there's no names there. I'm not going to say the hospital or when, but I'll tell you about the experience and what pediatric nurses do, maybe how we feel, just a little better understanding of how we feel. I was working day shift at the time. We did night shift 7 p.m. to 7 a.m., day shift 7 a.m. to 7:30 p.m. We overlapped 30 minutes. And we changed day and night shifts quite often. So at this time, I was an LPN. In some parts of the United States, it's called an LVN, or licensed vocational nurse. I was an LPN, licensed practical nurse. And I was an LPN working maternal, child, and peds for 13 years before I completed my RN. I went back to school at about the 10-year mark and then finished my bachelor's in nursing. So I worked with some wonderful RNs. I got on shift in the morning and I go in to report, and we are told what happened during the night. So there was a code during the night. It was the child over in that particular room. And they coded this child for quite some time. The little girl didn't make it. Now, she was 12 months old about. And the problem is that we couldn't locate the parents, okay? And believe it or not, this happens a lot. Parents drop kids off in ERs. Parents intend to come back and can't. They have other responsibilities or obligations. They leave when their child's in the operating room and don't return. Just a lot of scenarios. In this particular case, the parents did not have a cell phone. And anyway, they were staying in a temporary place between their house. So we could not get a hold of them. We had an address. We even sent law enforcement out to try and find them, and they could not find them. So what we had to do was just wait for them to come in. They had no idea their child coded. They had no idea what had happened throughout the night. So I get out of report and I'm assigned to that room, to that child. And I hadn't done this yet. So I had a wonderful RN named Sandra, who was the charge nurse that day. She came into the room with me, the door closed, there we are in the room. We needed to take all of the tubing out of the child's body. We needed to wash, bathe, and prepare this child for the parents to come at any time. Yes, there was blood. There was an intraosseous IV. It doesn't go in a vein, but it goes down into the leg, and we needed to get that out. We needed to disconnect everything. The other IV, child's monitor, stickies were on. The room was a mess. I'm sure you've seen, even on TV, or pictures that were leaked out of what an ER room looks like, a treatment room looks like, and what it looks like after a code, and it's a lot. It's not as though a couple things are tried and then we're done. It's that everything is tried for a long time. Code is called, lots of people come. Everybody's there for the sake of that patient, child, baby, adult. Unless they are a do not resuscitate, or everything is done to try to save that person. So Sandra told me, okay, here's what we're going to do. We're going to clean her up. We need to be quick about this in case the parents come. I'm going to put a sign on the door first that says, if parents arrive, please come see Sandra at the nurse's station, because she's the charge nurse. So she did that, and then she told me, let's unhook a few things, which we did. Then she said, I want you to pick her up and hold her while I strip the bedding and go get fresh linens. So I want to tell you what that felt like for me. I had one child at that time, and it just, maybe I would have felt different had I not been a mother myself of a child of similar age. I don't know, but this is how I felt during that process of holding a child that has passed on. Sandra left. I pick her up. She strips the bed and she leaves. And I have the weight of this little 1-year-old in my arms, and her eyes were blue. She was this direction. Her eyes were wide open. And I sat down with her because Sandra was taking too long. And so there was a rocking chair there in this pediatric room, and I sat down in the rocking chair with her. And if you're a mom, or even if you're not, you start rocking a baby that's in your arms, you also are going to be very respectful to not at all damage skin, cause any more marks, disconnect something and cause a further issue. So if something isn't working for you, if you're trying to close eyes, or you're trying to move an arm, or you're trying to position a child in a better way to clean and wrap a baby, don't force it. So I'm in the rocking chair with her, but here's how I felt. Interestingly, I felt incredibly guilty. I felt guilt because I thought instantly, this mother should be doing this. This father should be doing this. They should be holding her and rocking her. They should be the first ones to be taking care of her, not me. So I did feel guilty about that. It's just my feelings at the time. Sandra finally arrived back. She got the bed changed, clean, had some blankets, and some towels, and we laid the little girl down, and then we washed her, and we cleaned her and positioned her into a more natural position. We wrapped her in blankets, and we made sure there was no blood on her body, and we closed the blind we didn't have drapes at that time, but we closed it on the window that looks into the room. The sign was up, and then we left her, and we waited for the parents to arrive. And you still have 5 other patients to take care of, and the lights are going off, and the other parents are asking for things, and someone needs to go to surgery, and someone's meds are overdue, and someone needs their insulin checked, and their blood sugar checked. They need their insulin. Trays need to go out. I mean, it's still a busy day. And that is the reality of being a nurse or somebody who is working in the hospital, is that a crisis can happen here in this room, but the other 5 rooms that you have, or 6 or 7 other patients, whatever it might be, they still need something. I read a comment recently about a nurse who was working during COVID, and she said that when a patient would pass alone, because at the height of it, no other people could come visit, that how much it just hurt her. It just was so awful. She's not there, the family's not there, she's there, but that she posted how she just had to then go into the other rooms. She had other patients to take care of. And someone made a comment about how she needed to get a new job because she was calloused and unkind and harsh. But that's not true. It's that you can't fall apart. You can't fall apart. You can fall apart later. You can talk to your coworkers or the social worker or the chaplain at another time. But if you have a 12-hour shift or an 8-hour shift, or there's a problem next door in another room, you have to tend to it. And that afternoon and into the evening, and I was at this point now at the nurse's station, we were all keeping an eye out for the parents and for that sign on the door and anybody else who might come housekeeping, anything. Hey, do I go into this room yet? No. So I'm at the nurse's station, and down the hall come the parents. And I see them coming, and I say, oh my God, let me go find Sandra. So I leave the nurse's station, I run, I go find her, I say, the parents are coming, the parents are coming. And so they came to that room and they are reading the note. The note did not say the child passed or coded. The note just said, do not enter. Mr. and Mrs. do not enter, please. Sandra, ask for the charge nurse, ask for a nurse. And so Sandra came to the room just as they were at that door reading this. And so Sandra held Mom's arms, and she said, wait. And she explained quietly what had happened. And the mom crumpled to the ground and was crying. I paged the residents and the staff, and so they came. Mom did go into the room, so did Dad. And then when all the staff was there to speak to the family, they came out. We let them know about the morgue, and that we had to, it really was, she probably should have gone down sooner, but we didn't know at what point, the parents were going to come. So we explained everything to the parents, and they went into the family room with the doctors. And then we brought the little girl, down to the morgue. So years prior to that, yes, when patients passed away, we did have a bag, and that it zipped, and we had labeled the patient, label the bag, and all this kind of protocol. It wasn't like that, at least at this hospital that I was at. It was just covering the patient when you transport to the morgue. Morgue is always often downstairs somewhere, and it is still, all of the respect is still there. You don't mishandle the body because the body is dead. You don't disrespect the body or the family because the patient has passed. Now, there are some cultures, they express what they want, what they need. Wait, we have people coming, whatever it might be. We respect that. Because the patient has passed, we are still going to respect the body. Bodies still get covered up. We know they're not saying, I'm cold, but we still cover them up. We still respect them. We still handle bodies with compassion, care, gentle, nurturing. I think that's important to say that, because I'm sure families wonder, what happened when I left, or what happens to my loved one? But I can assure you that there are outlying circumstances somewhere, I'm sure, but I can definitely assure you that what we are taught and what we do is we treat everybody with respect, alive, passing, or have already passed. So I never saw the family again. When they came out of the family room, they left. And, then other protocols are in place, coroner calling to pick up bodies, that sort of thing. Making arrangements, helping the family, calling social work. Thank God for social work. Thank God for chaplains. We rely on them as part of our team to help families through beginning, middle, and end of what might be going on in their hospital stay. I will never forget this child. I will never forget her blue eyes. Not in a creepy or weird way. This is just a beautiful child who passed away before her time. I can just let you know that she wasn't well. Then she coded, and a disaster happened. I mean, that's just what happens. And during a code, either people can make it through, or something happens and they don't. But if you have any questions, what happens during this time, what happens during that time, I would be happy to answer that for you. And I hope that this was helpful, or I hope that this was at least reassuring to anybody out there who has any questions. Thank you for watching.